Well, I think that their experience in a clinical trial with this direct-to-patient model just lends itself to a higher compliance and a more likely for the patient to stay in the study with a higher retention because they get to know our team so well. So it seems like it wouldn't be the case because we're doing this remotely. But when you have a nurse coming into the home on a regular basis and really getting to know, and not in a clinical setting, so you're in the patient's living room, they're letting you in their home. And I think you do get to know them just a lot better. I think I've been at a brick and mortar site as well as Science 37, and I have dedicated time for that teleconference. And I'm there one-to-one with that patient, as opposed to when I was at my brick and mortar, I had 4 rooms and 5 patients and, going back and forth. This is a dedicated time. And so I think we really spend that extra time. I also think that the information we get from the patients in their home environment is very important. I'll give an example. When you ask a patient what medications they're on, which is obviously very important for eligibility as well as their study participation, if they're medications that could be exclusionary or could interact with the IP. And if you have a patient in a brick and mortar site, you ask them to bring the medicines and maybe they'll bring some, or maybe they'll bring a bag that says, oh, I take 1 of the white and 2 of the blue. And, it can be very, very difficult, as opposed to when we're in the patient's home. The nurse can actually, with the patient's permission, of course, ask to see their cabinet and lay out the pills. And sometimes there's that one bottle in the back that the patient says, oh, I hardly ever take that, but it may be something very critical. And so I think that we just get to know the patients. I think we get really valid, real data from them. I think they are so comfortable with us. They're comfortable in their home, especially for something like a prolonged PK. Our nurses can go back and forth, leave their car, go to Starbucks, come back. And, the patient, especially if we were talking about pediatrics, keeping a child in a brick and mortar facility for 12 hours can be a disaster. But if they're home and they're playing with their toys and the nurse, brings a stuffed animal and is interacting with them, and it really is so much less disruptive. So I think that, the comfort, the retention, the enrollment, all these things just really are advantageous for the patient.